Our next presenter is Dr. Oscar Arrieta. Since 2005, Dr. Arrieta has been the head of the Thoracic Oncology Unit and the Laboratory of Personalized Medicine at the National Institute of Cancer in Mexico City. Additionally, Dr. Arrieta is a faculty member of the National Autonomous University of Mexico with more than 25 years of experience. Currently, he is a medical oncology and thoracic oncology professor and is the current IASLC regional representative for Mexico and South America. And Dr. Arrieta is going to present on depression, anxiety, and distress impact in patients with thoracic malignancies during the COVID-19 pandemic. So I'll pass over to you, Dr. Arrieta. Thank you very much.
Thank you. Thank you very much. I will share my slide.
If you just want to put them into presenter mode, Dr. Arrieta, brilliant. Thank you.
Thank you. I would like to thank the committee for the opportunity to share our results of the clinical and social impact of the COVID-19 in patients with lung cancer. This is my financial disclosure. And first, accumulated evidence indicates that the patients with lung cancer are vulnerable population in the to the COVID-19 complication. However, a delay in the treatment can negatively affect patient prognosis. This study evaluates the impact of the COVID-19 in terms of the anxiety and the depression in patients with lung cancer, as well as this association with delay or suspension of the therapy. Additionally, we evaluated the impact in terms of the prognostic of outcomes of the change of the oncologic treatment and COVID suspension in this patient. This cohort study includes patients with thoracic neoplasms within a single institution between March 2020 and February 2021. All variables of interest were extracted from the electronic medical records. During this period, the depression, anxiety, and the stress was evaluated by the scale -21, was applied to evaluate and identify more common psychological disorders. Here we can see the change of the treatment during the COVID-19 pandemic. Among study participants, 24% had adjustment in the treatment due to the pandemic. The principal reasons to change the treatment was they avoid the exposure to the COVID-19, and other is the suspicion of the COVID infection. This is around 35% and 10% of the patient respectively. The most common kind of the change of the treatment was delayed more than 7 days in 42% of the patient, and the dose modification in 10% of the patient. The treatment interruption was observed in the 37% of the all patients. We can see here the association with the depression. We found a high depression in the 18% of the patient, anxiety in the 30% of the patient, and the stress in 18% of the patient. Of course, the depression and the stress was associated with the treatment delayed with a very high risk to the change of the treatment in this patient with depression and the stress. And we can see here the effect of the prognosis-free survival and the overall survival in the patient with treatment modification related with the COVID-19. Of course, we found a very important effect in the prognostic survival and the overall survival, and reduce the prognostic of the patient. On the other hand, we found also the patient that with a suspicion of the COVID-19 impact also in the prognostic survival, in the overall survival. Of course, we found a fatality rate around the 28% of the patient in all patients with the thoracic malignicities, and of course the patient with infection with the diagnosis of the COVID-19 affect in the overall survival compared to the patient without the diagnosis of the COVID-19 mortality. The complete results of this study was published in the Oncologist, the journal The Oncologist, and we can find all results. Maybe here the most important is the change in the health quality due to the COVID-19 demand make worse patient prognostic due to considerably delays in the treatment. Cancer treatment cannot stop even during the COVID-19 pandemic. Change with favor a safe environment for the patient in oncology, in age oncology unit must be prioritized in order to continue offer the highest quality care, oncology care. Thank you very much.